Support for the statewide broadcast of The State of Ohio comes from Medical Mutual, providing more than 1.4 million Ohioans peace of mind with a selection of health insurance plans. Online at medmutual.com/Ohio. By the law offices of Porter, Wright, Morris, and Arthur, LLP. When dealing with legal issues facing businesses and individuals, the first step in communicating is listening. Porter Wright, making sense of it all. More at porterwright.com. And from the Ohio Education Association, representing 124,000 members who work to inspire their students to think creatively and experience the joy of learning. Online at ohea.org.
The state of Ohio this week is dedicated solely to examining the state's deadly and devastating opioid crisis. We'll return to our regular coverage of politics, campaigns, and state government next week. But in the meantime, please visit our website at statenews.org for the latest. Welcome to a special edition of the State of Ohio. I'm Karen Kassler. There are as many as 170,000 Ohioans who abuse or are addicted to opioids, according to a recent study from Ohio State University's SWANK program in rural-urban policy. Abuse of and addiction to prescription painkillers and heroin cost thousands of those people their families, their jobs, their homes, and in the case of almost 10 people a day last year, their lives. The study put a dollar value on all those losses at $8.8 billion a year. Every year, hundreds of people in recovery gather with family, friends, and others who help them for the Rally for Recovery at the State House. I spoke to a few of them about their journeys and what was missing that might help more people find hope.
This is great because people that are in a hopeless spot or at rock bottom or just need something can come here to these events and get hooked up with the programs that will work. But it all boils down to how much they want it themselves.
You know, once you go through that detox and you do that little 30-day program that they have there, then you're out on the street and you have no furthermore recovery than that other than going out and going to meetings and doing things like that. Without that, there's nothing, you know, and yeah, there could be more aftercare.
95% to 98% of these people that we're dealing with our 855 number do not have insurance or they have Medicaid, and try to place somebody in detox or into recovery is near impossible.
I think the state is doing the best they can. I think there's a lot of resources in Ohio. Ohio has the dubious honor of being, you know, the #1 state in the country with dealing with the opiate epidemic and overdoses.
There are many who make it into recovery, but there are many who don't. Last year, more than 4,000 people ended up in morgues in Ohio, and some of those morgues have reported being full to the point where they've needed refrigerated trucks to store bodies. And the Ohio Hospital Association says its most conservative projections show that, should these trends continue, Ohio will be managing over 90,000 opioid overdoses annually by 2025. Emergency rooms, courts, and jails have become the front lines in the battle, with pictures like this one distributed in 2016 by the East Liverpool Police Department showing the horrors they're facing every day. Nurses, doctors, judges, and officers have been working as first points of contact, connecting addicts to treatment. As Andy Chow reports, these advocates believe the programs fill in the gaps of connecting addicts to the help they need.
At times you feel alone, but once you start using, a lot of times you just give up and you just feel like there's no hope.
Dressed in a faded green inmate uniform, Travis Orrin of Columbus sits in the Pickaway County Jail. He was arrested for not paying child support, but Orrin has a much bigger problem. For 7 years, he's been addicted to drugs. It started with prescribed pills and led to heroin. And while sitting in jail may look like a grim situation, this is actually a time of hope for Orrin. That's because the Pickaway County Sheriff's Office has a program that connects addicted inmates with treatment, using the medication known as Vivitrol, which has been proven to help opioid addicts.
Yeah, they definitely know there's a problem out there because a lot of times the same guys in and out, but now they're starting to get, like the Vivitrol shot. They're trying to send them to programs so that, they don't come back because it's just a vicious cycle.
Lieutenant Gabe Carpenter leads the program. Not only are inmates connected to treatment, but a deputy drives them to the doctor immediately after they step foot out of jail.
Because they're faced with that question once they leave, oh my gosh, that craving comes back immediately as soon as the clang of the door, and they know they want it. And so we got to try to cut that part of it off to give them a little bit more support out the door.
This way of thinking is not just happening in jails. It's in hospitals, where medical personnel try to identify addicts through a screening process, then connect them to treatment. It's also in courthouses, such as the Hocking County Courthouse in Logan, where there's a special court docket. Addicts can plead to a lesser charge in exchange for joining the program. These types of measures go by many names, such as integration, coordinated care, or perhaps most commonly known, intervention.
Treatment is extremely important, and it's really important to find people who need treatment where they are.
Joshua Sharfstein is a director of the Johns Hopkins University's Public Health School. He's done extensive studies of what different states do to curb the opioid epidemic. According to Sharfstein, states with robust intervention programs are starting to turn the tide in the battle against opioids. But he says jails, and especially hospitals, can do even more. Researchers from Yale found that the success of a treatment program can double if doctors administer that medication assistance, such as Vivitrol or methadone, in the emergency room.
Unfortunately, many hospitals don't offer that kind of treatment, which is kind of crazy if you think about, well, if you had a treatment that you could provide for diabetes in the emergency department, well, you'd expect every hospital to do it. And in fact, every hospital does do it.
The state has started to recognize the important role jails, hospitals, and courts play in intervening. Last year, Ohio's prisons enrolled 15,000 inmates into Medicaid so they could receive treatment once released. Special court dockets around the state, including Hocking County, helped more than 940 people get treatment and other services. Lori Chris is with the Ohio Council of Behavioral Health and Family Services Providers. They represent the groups that deliver treatment. She says providing full, comprehensive treatment that actually pulls people out of their addiction requires every gap to be filled.
So when a person is motivated and they have the capacity to take advantage of the opportunity of treatment available to them, then that's the time that we need to make sure we're engaged with them. So having law enforcement and hospitals know that the person's at a critical moment and connecting them immediately to behavioral health services is critically important.
Back in Pickaway County, Carpenter says law enforcement have taken a hard look at their role and reevaluated what they should do to help people who may initially seem like criminals, but are also people who need help.
It's a win-win for me because not only are they getting help becoming a productive member of society, but I don't have to see the revolving cycle. You know, we're trying to break it, and right now that's the best way that we can do it.
The same reevaluation is happening at hospitals and courtrooms too. For Travis Oren, he has seen the light of sobriety and felt the pain of relapse. But with his new treatment on the horizon, he feels this might be his way out for good.
There's hope out there. Just stay focused. If you go to some meetings as soon as you get out, if you're in jail or you're incarcerated, first thing I do would be go to a meeting, get a support group, get connected, and just stay motivated, and it gets better. It really does.
Andy Chow, State House News Bureau.
The opioid crisis has blasted devastating holes in families, and those victims will be healing for decades. There are more than 15,000 kids at Ohio's foster care system and just 7,200 families to take them in. In some counties, more than half of the kids in protective custody have to be placed in other counties. The budget that took effect in July included the first funding increase for children's services in a decade. And the number of babies born addicted has gone up 8 times what it was in 2006, costing hospitals $133 million. A new $2.5 million facility is now open in Kettering, near Dayton, to help babies and mothers in a quarter of Ohio's 88 counties.
So when that baby comes in here, the baby will be cared for 24 hours a day through that withdrawal until they're finished with the medicated withdrawal. And then we'll be working with mom with children's services. So really understanding what situation she's in and understanding the rules around children's services to help advocate for her.
The facility is able to serve up to 40 infants at a time. That is a fraction of the 2,100 babies who arrived addicted in Ohio in 2015. The journey addicts take when trying to put their lives back together is not easy, but they can be successful. Joe Ingles reports on two things essential to recovery: mental health treatment and job retraining.
It is 32508.
A handful of students sit in this classroom in an old school building on the south side of Columbus, developing in-demand technology skills. Among those learning how to use computers is Columbus resident David Givens. The former University of Cincinnati student studied information technology for 3 years before dropping out to take a full-time job to support his first child. His mother passed away around the same time. He became depressed, and he was in and out of jobs.
You know, I was hanging out with a group of friends, and all we did was party. So that led to drinking as well as like prescription drugs, you know, your Oxycontins and your Percocets and your Vikes.
Givens was convicted of drug and other crimes and went to prison. Now that he's out, he's learning new job skills and looking for a company to give him a chance so he can provide for his 6 kids.
I put my children first, and you know, they look at me as their hero. So I can't let them down. So even though I might be on the down verge, I gotta get myself up every day.
Givens is trying to get his life back together with help from Digital Works, a company that has trained and placed more than 900 people in IT jobs since 2013. The vice president of Digital Works says his organization helps a lot of people like Givens.
Generally, about 50% of our participants are what I would call vulnerable populations, either chronic unemployment, generational poverty, or background issues, generally related to addiction issues.
Stu Johnson says while his organization focuses on job training and employment, it works with other existing services to help those fighting addiction.
One of the symptoms of addiction is it takes everything from you. It takes your family, it takes your friends, it takes your money, it takes your benefits, it takes your entire support system, and then it takes you, where you have no help, no hope, no dignity.
Johnson says that's why Digital Works connects its clients with wraparound services to help them with transportation, mental health, financial literacy, or other needs. One of those organizations is Amethyst. It provides housing, counseling, and support services to about 150 women each year as they battle back from drug addiction. Rachel Huddleston, a Columbus mother of 4, is working to overcome the heroin addiction she developed after discovering her husband was hooked on it.
After I had our 3rd daughter, I found out he was doing heroin, and I could not fathom the thought of losing him, so I joined him. And that was the most difficult day of my life. You know, I thought, if you can't beat him, join him. And I started doing heroin at the age of 26. And within 8 months, my life had spiraled out of control. I had overdosed twice in front of my children, had to be taken to the hospital and brought back to life.
Huddleston remembers the day she was arrested for burglary while her children were in the car with her. She says her 3 oldest daughters have been getting counseling to deal with what they've experienced.
My oldest, I believe, has PTSD because she's seen me repeatedly beat up. She has very bad stories of watching mommy puke on herself, mommy and daddy fighting over a needle.
Huddleston says she feels a lot of shame because she knows firsthand how hard it is for a kid to grow up with a troubled childhood.
I grew up in a very domestic violent family. My dad brutally beat my mom for 10 years. And then about the age of 6, he became very fond of me in ways that were not right. And it took me a long time to realize the things that he was doing as a father were not just because he loved me, because he had a problem himself.
Huddleston says the treatment she and her children have received at Amethyst have given her the tools to deal with her past in a sober way and have helped her to enjoy positive experiences with her children. The managing director of Amethyst says 85% of the women and families served by her organization have either mental health or trauma issues that need to be treated before the addiction.
If a client has traumatic
circumstances in their background. What we've discovered is until we break through that trauma, until we get to the root of that, that client is not ready in any way, shape, or form to even begin the treatment process.
Because of that, Amethyst is a longer-term program. The average length of stay is 21 months.
Because what we have found is 6 months doesn't do it, 9 months doesn't do it, sometimes 12 months doesn't do it. Many of our women have been through other short-term treatment programs and they haven't been successful. So it takes time.
Amethyst program has a 90% success rate, but it can only help 100 clients at a time, and the demand for services is high. It's expensive, but it's less than half of what it costs to keep them in prison. Joe Ingalls, State House News Bureau.
As you've heard, money is a big part of battling this epidemic to pay for law enforcement, treatment, health care, and social services, among other big-ticket items. The state has filed a lawsuit against 5 drug manufacturers and is also considering adding drug distributors as well. But it could be years before any settlement might come that could help people in need now. So as with any statewide crisis, state money is considered key. I talked with Governor John Kasich about that in October. Is the state spending enough money proportionate to how this kind of an increase in death?
Well, look, I mean, we've had a giant increase in this period over the last few years. Do I think that spending a heck of a lot more money is going to, you know, you could always use more money. You could always have more recovery beds. You could always have this. But I think it's been a significant increase. And we're starting to see results. Because of the tightening of our prescribing guidelines, we've seen like a 20% reduction in the number of doses prescribed. So it's all working, but we're not going to get out of this overnight.
Kasich says overdoses from prescription painkillers are at a 6-year low, and he credits the state's crackdown on pill mills in 2011. But heroin deaths have soared 327% since 2010, and deaths involving fentanyl are up nearly 10 times that. Kasich's Mental Health and Drug Addiction Agency director says that 20% reduction in overall prescription pill doses will pay off in the future.
Those are people who are less likely to initiate long-term drug use. There are fewer pain pills that are available in people's medicine cabinets for diversion, which is positive, and people hopefully are thinking more about the risks associated with these controlled substances.
But there are still plenty of questions about whether Governor Kasich and Republican state lawmakers are doing all they can. Twice, Democratic state lawmakers have called for money from the state's rainy day fund, currently sitting at over $2 billion.
So we have asked the governor a couple weeks back to declare a public health emergency to free up some emergency dollars.
We're talking about dealing with 10% of the rainy day fund in order to help deal with addiction on the ground today.
And Democratic U.S. Senator Sherrod Brown is also wondering about lawmakers' reactions to the crisis.
That's a good question. What are they doing? They're not doing enough. I mean, we're not scaling up. We're not scaling up the treatment programs quickly enough. Clearly, the state legislature keeps trying to cut Medicaid spending. I mean, when there are 200,000 families in Ohio right now, 200,000 people that are getting opioid treatment because of the Affordable Care Act.
House Finance Committee Chair Ryan Smith, the Republican of Gallup Police, says $20 million was put into the budget for new treatment facilities. And he says more money was added for kinship care, child protective services, and drug and mental health courts, even as the state was facing a $1 billion budget hole.
I'm a little bit offended, frankly. I think we tried to address it even amidst a $1 billion hole last year. And we put $180 million into it. And I'm sure people can say it's not enough and that type of thing. But, you know, we have to budget responsibly. And I felt like we did that to try to address an epidemic that certainly needs some attention.
And a document provided by the State Office of Budget and Management says money that the state is counting as opioid crisis battle funds shows it kept pace with opioid deaths as tracked by the Ohio Department of Health. Funding soared in 2013 as Medicaid expansion was enacted in Ohio and as overdose deaths skyrocketed. But in the last 2 years, the numbers of overdose deaths have risen much faster than the money the state says it's putting aside to fight the epidemic. There is no breakdown on federal money versus state funds, but the Kasich administration has said that 2/3 of the nearly $1 billion now being spent to fight the opioid crisis is federal money, most of it Medicaid expansion dollars. And the state has not declared the crisis an emergency.
We have been operating as if this is an emergency for a number of years now. I mean, we've introduced more resources, we have changed policy, we have worked to activate, in collaboration with communities, and so I feel very strongly that we have been treating this like an emergency for the last 6 years.
But as for the rainy day fund, the Kasich administration says the budget stabilization fund, as it's known, should be used as a last resort in a financial crisis. But House leaders, including Representative Ryan Smith, were so concerned about the sustainability and costs of the program, they put some restrictions on Medicaid spending in the budget, including a Medicaid expansion enrollment freeze. Kasich vetoed that, but that could be overridden anytime before next December. Kasich and his team have focused a lot on prevention and stopping drug abuse before it starts, for instance, through his Start Talking campaign.
Got to love our kids. We got to talk to them about this. And no, the answer is no. I don't want to be cool by taking drugs. That's what we're trying to do with Start Talking.
Everyone can talk to young people about, making healthy decisions for themselves and for their futures.
Talk to your family. Talk to your kids through the Start Talking campaign.
Prevention efforts may seem like low-cost ways to battle the opioid crisis, but they're not free. The Center for Community Solutions in Cleveland has studied the opioid crisis and its devastating effect on communities and the spending that's being done on it.
I think we were struck by how little state dollars go into prevention efforts, that most of the money that goes into prevention in Ohio is federal funds. And so that may be a place where the state wants to invest more of its own money.
Corlett also says Ohio should ask for a waiver to allow for treatment in facilities with more than 16 beds, as West Virginia has. And Democratic Senator Sherrod Brown and Republican Senator Rob Portman have proposed a bill to raise the cap on beds at residential treatment facilities from 16 to 40. Two experts from Ohio State University who've looked at the state's efforts to battle the opioid crisis say Ohio only has enough treatment capacity to reach 20 to 40% of the addicts who need it.
This has been such a fast-moving crisis, and especially in the past 3 or 4 years when we've seen more illicit drug use like heroin and fentanyl, overdose deaths have really increased very rapidly.
And it also overwhelmed in areas that maybe we didn't expect, because certainly with the drug crises we'd had before, they had been in urban areas. Now we're in rural areas, rural Southwest Ohio, for instance. That's an area that may not have been expecting that, right?
Well, yeah, traditionally, a lot of our rural areas haven't faced at least a hard drug problem. And right now, that is where the opiate addiction issue is concentrated. It tends to be concentrated in rural areas, and rural areas have considerably less treatment facilities per person than what you would see in urban areas. So not only do they experience the worst of the addiction, they have the least resources to actually treat it.
And that's actually very interesting. You talk about how there are 26 certified methadone treatment centers, but only 2 of them are in rural areas, in Jackson County and Athens County. That leaves people in rural areas to have to travel to urban areas to get the treatment they need. 377 doctors in a state this big that are certified to prescribe one of the drugs that you say is one of the 3 that's needed to combat this crisis. That's amazing.
Mm-hmm. Yeah, and that was one of our recommendations. And you think when you start to address an issue and you start to look into things, particularly like you say for those in rural areas, if you're thinking of someone who's struggling with addiction and they need daily treatments with this to drive an hour and a half or 2 hours to receive the treatment, it's just putting up larger barriers for people to get the help that they need.
If you have these 3 drugs that are available or are proven to actually help here, why aren't they more available? Is there a particular reason? I mean, they can't, as I understand it, be just sent home with people. Right. There need to be treatment centers where there's a process.
Right, right. Yeah, I think they're, the main reason is that they're pretty powerful drugs. So they have to be administered by a doctor and someone who's licensed, who's received some training about how to administer these things. So you contrast that to something like Narcan that is now an over-the-counter overdose reversal drug. This is a very different class of drug that is helping with withdrawal symptoms. Some of these drugs are often abused by those who are using them. So methadone, people overdose on methadone, and some of these other withdrawal drugs, they use them to actually get high because some of them actually do produce a high.
You also write about some things that you think the state could do to try to address some of these gaps, some of these areas, and it's a 2-pronged approach here. One seems like a more immediate prong than the other. The more immediate one is that immediately more treatment. And how do you get to that point, and why, if it could be done, why isn't it being done?
Well, that was the point of one of the points of the report is that we're trying to show the cost of this crisis is so high that we're talking, that the state should be investing large sums of money. Like, as you said, there's reluctance among politicians in a tight budget to spend money. And we're trying to show that this is such a crisis that if we don't start, it's going to have a corrosive effect that eventually, have really adverse effects on the economy. The other issue is that all states are just overwhelmed by this, and we all need federal help. And it was unfortunate when President Trump announced the crisis, he had no federal funding. We're hopeful that will change because the federal government's the one with the resources. The states just simply can't handle this.
The researchers also found a person whose highest level of education was high school is 14 times more likely to experience an overdose. That's interesting when compared to another stat that Ohio spent $8.2 billion on K-12 public education in 2015. That is less than the $8.8 billion the researchers estimate the opioid crisis is costing the state every year. Thanks for watching this special edition of the State of Ohio. Please check out the State House News Bureau for Ohio Public Radio and Television at statenews.org, and you can follow us and the show on Facebook and Twitter. And please join us again next time for the State of Ohio.
Support for the statewide broadcast of The State of Ohio comes from Medical Mutual, providing more than 1.4 million Ohioans peace of mind with a selection of health insurance plans. Online at medmutual.com/Ohio. By the law offices of Porter, Wright, Morris, and Arthur, LLP. When dealing with legal issues facing businesses and individuals, the first step in communicating is listening. Porter Wright, making sense of it all. More at porterwright.com. And from the Ohio Education Association, representing 124,000 members who work to inspire their students to think creatively and experience the joy of learning. Online at ohea.org.